You're listening to the Phil Klein Dental Podcast from VivaLearning.com. Today we'll be talking with Dr. Sarah Winter, who has a cosmetic-focused practice in La Jolla, California. Until recently, she used two different composite systems for her direct restorative cases: a microfill composite for the anterior in order to get high polishability, and a bulk fill for the posterior, which provided lots of strength. But recently she found one material that actually does both, which has made her life and the life of her staff a whole lot easier. To tell us about what she's using and why is our guest, Dr. Sarah Winter. Dr. Winter, it's a pleasure to have you back on the show.
Hi, Phil. It's a pleasure to be back on the show. Thanks for having me.
Yeah, our pleasure. So what are some of your key considerations when choosing a composite for your direct restorative work?
I think probably a lot of the considerations that all of us dentists have. When it's in the back of the mouth, I want something that's going to hold up well. I want something that's going to fill in all those little crevices. When it's in the front, I want to make sure that I have a wide variety of shades available. I want something that's going to be strong, and I want something that's going to polish really, really well and be beautiful.
And with all the advancements of dental materials, specifically direct restoratives, aren't many of these companies coming out with composites that do all this, or did you have to really sift through what's out there, try it, evaluate it, talk to your colleagues? Like, what's the process of actually selecting the one you want to use for your practice? And like I mentioned, it seems like a lot of them should be equally as good.
I think there's a lot of great products on the market for years, and all of those things that you talked about went into it. You know, the CE that I take into account when you're using products in the CE and what all of the other, for example, cosmetic dentists, if I'm taking anterior cosmetic classes, I'm definitely going to veer more towards some of the anterior composites that are used there. I want to make sure that they polish really well again. So that's an anterior case. For posterior, I want to make sure that it's strong, that the colors are, good, but that's not quite as important to me. I love a bulk fill at times so that you can get that depth of cure in the posterior. I personally have always had composite that I use for aesthetics and composite that I use for strength, and they weren't the same. I love Cosmetic. Historically, I've always loved Cosmetic for my anterior aesthetic composites. And in the posterior, I would veer more towards Filtech. I have tried a variety of others, and those have kind of been the ones that I've come back to just because I like the way that they work in my hands, and I like their longevity for what they are. Recently, EcoSit Elements came out, and it's composite that has both very high polishability and high strength. They also have a variety of shades, so I have slowly been incorporating them to both my anterior and my posterior. They polish really, really well for the anterior, and they're strong for the anterior, so I'm not getting as much of those little corner chips that you can get if you're doing anterior composites, and the incisal edges tend to be a little bit weaker.
So we talked offline, Dr. Winter, about your desire to use microfills in the past because you wanted to get this perfect polish, but then you had some issues with that, and that kind of led you to explore new options in composite. And right now, obviously, you're very happy with what you found. Tell us about that transition.
So one of the things, and I think this speaks more to the dentists that are concerned with cosmetic dentistry, but for me, I want my work to be beautiful. I photograph all of my work. I want the patient to love it. And so for years and years, I've been using a microfill in the anterior region, and it polishes beautifully and it looks phenomenal. And I take the photos and the patient is really happy. And then a week or two later, you get a phone call that there's a chip here or a chip there, and it goes from a really great patient experience to a really negative patient experience. And so while I might be happy when I'm taking the pictures, I definitely am up that night, kind of hoping and crossing my fingers to a certain extent. So having a system where I can get all the shades that I want and need to be able to do this beautiful anterior cosmetic work, and having it be simplified across the board as far as the shades that are offered. For example, in other brands that I've used, there's like super bright 1, super bright 2, super bright 3, there's so much shade selection that it can be overwhelming. And so this really, I feel like, is simple in that there's like enamel bright, enamel light, enamel medium. It's words that we all know and understand, and you can grab when you have that emergency chip on number 8 that you're squeezing in and you only have, half hour, 45 minutes. But additionally, I know it's going to polish really well. I know my photo is going to look really good. And in the end, I sleep a little bit better because I'm not getting those phone calls that there's all those microchips and the color sloughing off. So I feel like that for me has become more and more and more of a go-to just for that reason alone. And I'm more and more just loving how it's performing in my practice.
So it seems that many dentists are trending towards single shade direct restorative materials. We know what those materials are. We've heard about them in the marketing of those products, etc. And these products that claim to be single shade are designed to kind of blend into the dentition. What's your feeling on that whole concept?
I loved the idea, and I definitely brought them into my practice and tried them. They're purported to have, chameleon effect. So once you get them in and you cure them, they sort of blend really well. What I was finding is that after, a few months, and definitely more so over time, to me, they looked gray. And so for me, I've veered away from using those. I didn't think that the chameleon effect was working quite as well as I wanted it to work. So I prefer to go back to things that have actual variety of shades that I can use to just color match anterior teeth.
You're not a firm believer of the single shade concept because that has been trending. You're not?
Personally, no. Not
Okay.
for my anterior composites.
Right, but you have reduced your inventory by not using an anterior and a posterior composite, 2 separate systems, right? With the one you mentioned earlier, the EcoSit.
Yes. The EcoSit elements, I feel like it's kind of a game changer. I'm super pleased with it.
How do you typically discover a new composite? Just so our listeners could understand the best way to possibly transition to another brand. I mean, obviously, it seems to me, I'm not a restorative dentist, I was an endodontist, but when I tried a new file system, if I liked it, then I would say, yeah, this is worth looking into, and I would try it and see how it went. Do you trial these composites before you go full out and purchase them?
Yeah, absolutely. A lot of times it's definitely word of mouth. It's definitely continuing education. My colleagues that I sort of look up to and respect what they're doing, and I've seen their work. Social media nowadays, there's a lot of dentists on social media who are putting out some amazing content, educational content, and that will kind of spark some interest. But it usually comes down to a colleague that I look up to and respect the work that they're doing, making a suggestion or talking about what they're using. And whether that's in a CE course or just talking to them personally. And then I will usually grab a couple colors and try it, usually on family and the girls in the office and myself, and then go from there.
How good are the composites that claim to be universal in that they fulfill all the dentist's clinical needs, both posteriorly and anteriorly? Are those, reliably universal as they claim to be?
I haven't found a ton of composites personally that I've used, that have claimed to be universal. I've always sort of known, I'm going to use a microfill for high polishability, but I know that what I'm giving up is strength. And then vice versa. Sometimes I'll use one of my other posterior composites if I really need strength in the anterior. But this EcoSite, the science is there for sure. And then, of course, how it works in my hands. And from what I found, this specifically, just that EcoSit really lives up to what it says.
The benefit of this particular product that you like, EcoSit, you're saying that it has the polishability similar to a microfill, but it obviously has a much more strength. How did they accomplish that?
Well, they will tell you that it's the nano cluster, that there's these really evenly spaced clusters of filler, those nanoparticles inside of a microfill. And it's because of that really even sort of non-clustering of the filler that's how you get that really high polishability. And because it's so nano-filled, you're going to get all the strength as well. So I feel like that's a win-win. The shade matching has become much easier. Even for my team, they've come to know, before I even get in the room, which shades I'm probably going to use. And 95% of the time they're dead on. And then B, it's not chipping the same way that the composite I was using previously was. And so that becomes a no-brainer as a clinician.
And you use a separate adhesive for this from a different brand before you put this. Yeah, tell us about that.
I use Bisco. I've used Bisco for years. I use the All Bond 3 or the All Bond Universal, sort of depending. And mostly for my anterior, I'm going to use the All Bond 3. And for my posterior, I'm going to use the All Bond Universal. It's been my go-to. I'm super happy with it. I don't find a lot of postoperative sensitivity, period. Historically didn't. I'm not getting any postoperative sensitivity using the EcoSit.
How is this used on molars?
I mean, for molars, I feel like I was happy I was using Filtech in the posterior, and I feel like I'm using EcoSit in the posterior mostly because I have one system and it just works really well. So, I was happy with Filtech. I personally love the workability in my hands of EcoSite, marginally above the Filtech. It's a little less sticky and it kind of flows in a little bit easier, but still has that workability where you can create the anatomy. So for me, it's almost in the posterior, it was more of an ease of use. I have one system, I have one box, and all of the composite that we need is going to come from there. So that was as important for me as the other attributes that it has.
So you mentioned also that your staff really likes the material. Now that's a kind of interesting point. I usually don't hear that when I do these podcasts. Most of the time they're talking about what they like, but it's important that the staff is comfortable with the material. So tell us about that. And you mentioned the shades.
So it can be pretty busy, and the girls that I have been here for a long time, and we have one person who's new. So it's wonderful to be able, I rely on them. So if they can get everything out and they're familiar with it, and it's just, so simple, they can pull the colors for me. They can pull, some of the alternate colors. They can try on the colors. If they can get everything laid out for me, it's less work for me when I get into the room, less work for them because they don't have to try and guess and pull out 5 different tubs of composite to see what's going to work for this particular case. And so it just makes it a much more seamless experience, both for the staff and for me, and then ultimately for the patient as well.
And what about the delivery system of this composite?
Yeah, no, I love it because it has both. It has it in the gun, which I mostly will use for the posterior, and then it has it in the carpules. The other thing that is nice is it doesn't tend to dry out like a lot of the other composites I have. If the top isn't all the way on, which happens when you're busy and you're cleaning up and moving on, it dries out. You almost have to throw away like that top, 4 millimeters of composite, which adds up economically, as we all know. I haven't been noticing that with the EcoSit at all. So far, it's been great. So it's just a lot of those little details that create a better work experience and make it more and more of, our go-to. And we started slow and we started small with it, and then we got, more and more. And then it's almost interesting how it literally just kind of evolves and you're like, oh, we haven't used what we used to use in 2 months. And then you realize I think I don't need to use that. I haven't thrown it away, but we haven't used it in several months at this point. So it's sort of the slow evolution of our go-to for all of those little reasons that create a better work experience.
Yeah, and those little reasons are really important for workflow. There's no question about it because dentists have so many things to do clinically and there are stressors throughout the day. You certainly don't want to be frustrated with having the material dry out because the cap's been off for a minute and a half.
And I don't know how other dentists feel about this, but when you are doing an anterior composite and the staff is so familiar, my assistants are so familiar with the color wheel that they can pull out the exact colors instead of pulling out the bin and having me kind of go through them or pulling out the paper that has them all. That's amazing to me. And I'm so proud of them. They take more ownership. It's a great benefit.
So I find it really interesting. You mentioned that you kind of transition to this new material. You keep the old material around, but then you find yourself using the new material quite often, if not for every patient. And then eventually you can realize you're not going to reorder the old material, but you keep it around just in case you see some indication that it might not be as great as you were hoping it would be.
Exactly. Yes.
Okay.
I'm hoping that's a universal dental thing. I still have still have so much
So much-
vintage dental things in this office.
Yeah, you can. Well, eventually, you'll donate it to a dental museum and all your old materials.
Yes,
Yeah,
exactly.
and eventually, EcoSit will be part of a dental museum. Everything. I mean, new materials keep coming out, but I know this DMG material is getting good reviews, and I'm glad we got to talk about it. And thank you very much for your input, Dr. Winter, and we'll have you on future podcasts soon. Thank you so much.
All right, thanks, Phil. I appreciate it.
If you're enjoying this podcast, please leave a review or follow us on your favorite podcast platform. It's a great way to support our program and spread the word to others. Thanks so much for listening. See you in the next episode.